Let's start autonomic nervous system. So as we have been talking about the somatic nervous system and the autonomic nervous system, what is the main difference between the somatic and autonomic? Somatic is innervating your what? Skeletal muscle, and autonomic is innervating cardiac muscle, smooth muscle, and glands. Okay, so this is the difference. So when we say autonomic nervous system consists of motor neurons that innervate your smooth muscle, cardiac muscle, and gland, make adjustment to ensure optimal support for body activities. Do you control all these things according to your will? You do not, right? What happens? How does that happen? It happens consciously or unconsciously or subconsciously? It happens subconsciously. Okay. Okay, so now let me give you some scenario. Before I give you some scenario, let me also tell you that your autonomic nervous system has actually two divisions. One is called sympathetic division, which is your fight or flight, and your parasympathetic division, which is also called rest and digest. So in your exam, you will have what? Some scenarios to identify. Is it sympathetic or is it parasympathetic? So we are going to talk about all those, but before I start talking about all those, let me see how much you understand just by intuitively. Let's see. Okay. So now, for example, you are sitting down right here and started like a little bit dizzy and not dizzy, sleepy. Which one is that? Parasympathetic. Okay. So what if you have seen all of a sudden your crush enters the room? Why sympathetic? What happens during that time? Your heartbeat increases and all these things, right? Okay, so now a tiger is coming to the room. Huh? Of course, sympathetic. Okay, a dog chasing you. Of course, if you do like dog, I don't think, huh? You might be chasing it back. Yeah, that's a good one. Okay, so if a dog that you do not know is trying to probably be a little bit you see what I'm trying to tell you. So what do you think is that's gonna be? Sympathetic. Okay, so now let me ask you, what if you have erection? It could be clitoris in erection or penis erection. Sympathetic or parasympathetic? Sympathetic? Sympathetic? Do you think it's sympathetic? It would never happen if you are not relaxed, unfortunately. Sorry. If you are very excited, I don't know if you ever had that experience that you are meeting with someone for the first time and the boy is so excited and nothing happened. I don't know if that happened to you, but why? Because too much excitation, too much sympathetic. So you have to have your parasympathetic up, right? But there is a twist though. Do you know what is the twist? So what about the ejaculation? What do you think about that one? Do you have to be excited for that, or do you have to be relaxed for that? Huh? Excited for that? Huh? Huh? It is increasing blood flow, of course. Of course, it requires a lot of excitement to be able to actually ejaculate. So, what is going to be that one? Huh? Of course, sympathetic. See, how did I grab your attention just talking about sex? Okay. So now let's come to some more scenarios. Okay. What if I enter the room? Sympathetic, scared? Scared? Okay. So scared, fear. These are sympathetic or parasympathetic? Sympathetic. Okay. Have you ever messaged your friend? I'm so excited to spend some time with you, watch Netflix and do this and that. Is it the right word? Are you excited or are you? What do you think? Is it going to be relaxing or exciting? Exciting. So you want to watch TV, eat, and then maybe fall asleep. Do you think is it exciting? Actually, it's a relaxing. But have you ever messaged your friend? I'm so relaxed to spend time with you. Yes. I'm excited to relax with you. Okay. So, what if you want to spend time with your girlfriend or boyfriend? Maybe in the very beginning, maybe not when you are like after 3 years of relationship. Maybe first few times. Exciting, right? Okay. But after 3 years, you're like, no way. Okay, so you got it what I'm trying to tell you, right? Okay, so you see, why do we call this sympathetic division? What sympathetic division is? What? Fight or flight. And your parasympathetic division is what? Huh? Relax, rest and digest. So what does it also tell you? When you have your parasympathetic up, which activity increases? Digestion. But when you have your sympathetic up, which activities increases? Blood flow, heart rate, most of your body activity actually increases, because during the sympathetic division, what you are trying to do? Sympathetic division, you want more energy. If you want more energy, you need more blood flow. All of your body part has to work harder, more. Okay, yeah. Yes, you do not produce more ATP in the sense, but your body, when you have your sympathetic up, your body really is trying to make sure that you have enough glucose in your blood so that you can generate more ATP. Okay. So this is a good question, because that is why it is not a good way to actually have the sympathetic up all the time, because you do not want your blood glucose to rise all the time. Okay. Okay, so sympathetic division is what is it trying to do to your body? It's trying to make sure that you are ready, set, go to use more energy. Yeah.
You say parasympathetic creates more energy, but sympathetic consumes more. Is that a good way of putting it?
No. So parasympathetic tries to conserve energy. They do not create more energy. They try to conserve energy. They basically try to shut down most of your body part, except trying to make sure that digestion does not mean that you are creating more energy. Digestion means you are just absorbing the glucose and then creating energy after glucose goes into the cell. Then you, after metabolism, you create the energy. Yeah.
So is it kind of like an all or none situation? Like
No,
one or is
it
active,
is
the
not.
other is action?
That is what I was coming into. Yeah. Very good question. I really like that questions. Just to let you know that you have both sympathetic and parasympathetic are actually what? Activated or active all the time to maintain the homeostasis. However, for specific situation, you might have one activated a little bit more, another is a little bit less. But both of them actually are active slightly all the time, all the time. Okay. So, okay, let me ask you another question from here actually. So what do you think? What happens when you have your parasympathetic activated so much? Do you think it's gonna last after that for a long time, or do you think your sympathetic up and then it's gonna last for a long time? What do you think is going to happen? Have you ever done any kind of like bungee jumping, skydiving, or if you have not done those, at least if you have, did you get chased by any kind of animals or anything? No, never. Okay. So yeah.
You're saying that your sympathetic can't activate, can't stay, you can't maintain that level for a long time. So
When
that's
you
the
have your
reason why.
sympathetic activated, you have to maintain that level for a long time. That is why today's what is it called, today's lifestyle, it's very stressful. Always have you have your what, sympathetic up, and once the sympathetic is activated so much, it's going to last for a long time. But parasympathetic is fleeting, short lived. You activate it right after, you can actually switch, but right after you have your sympathetic activated so much, you cannot switch. It's going to take a long time. It's going to take a long time. So it did happen to me so many times. I'm a very adventurous person. I used to be, not now. I used to be before I had daughter. So after I had my daughter, I became like, really, I'm like scared to even drive. I'm scared to even go out of the home. I'm like, would I be able to come back to my daughter? Like really. But before I had my daughter, I was so adventurous. I did scuba diving, I did skydiving, I did like paragliding, I did like whatever, all the things that you can say, like all the different adventurous things that you could say. But even after that, one time with my daughter also, there. So let me tell you that story. That's important. So this is important for you to understand right here. So I did not grow up in a very dog or animal friendly environment. I'm kind of scared of that. I feel sad to talk about that, but this is what it is, right? So I am scared. So now one day I went to pick up my daughter from her daycare. So I picked her up, and right after I turned around, I saw that there is a dog right behind me standing over there. Okay. So right after that, I'm like, my sympathetic activated like so much, because it's not something I am like, I don't know what is the dog looking for, because as I told you, I did not grow up in a very animal friendly and friendly environment. So I have no idea what's going on. But my sympathetic up, because my sympathetic is not familiar with this kind of situation. So what I did, I just ran. I did not even think about my daughter. Can you imagine? So when you have your sympathetic up, all these things actually, you do not even have any control that what you are like. It's like really up. You do not even have like other type of like feelings that we actually talk about. So that is why these days there are so many ways to make sure that you are calm, right? So that you are meditating, you are doing breathing exercises, all these things, so that you are calm and you can take right decision. Whenever you have your sympathetic up, you cannot take right decisions, because it is what actually you are, what you, what is overriding, your brain is overriding, your brain is trying to save you, so it does not want to think about anything else. Okay. So that is one thing, but let me tell you the rest of the thing. This is something made me like really sad afterward. I'm like, how could that be? This is the love of my life. I cannot imagine my life without her. And then this is what I did. I was running, she was running, she was trying running, mom, and I'm running like, yeah. So now finally I was able to get into the car, but I was like so devastated. And after that, I came back home. Can you imagine, like I couldn't come down for maybe at least for 4 to 5 hours. It took me more than 4 to 5 hours. Nothing was working. Literally, I had to start soaking myself in the bathtub to be able to like relax for long time. And then I could not even imagine that I did that to my daughter. I couldn't like forgive myself for a long time. Like, how did I do that? But you know what, I did not do that intentionally. It is just, it is. So what I'm trying to tell you right here, the sympathetic is definitely good for you. You need it to be able to survive in this world. Your brain wants to save you, but you do not want it to be very activated all the time, because it is not very good for you. Yeah, what did you want to tell me?
I was gonna say, I mean, at least you didn't trip her. Yours was out of your control.
Yeah. Yeah, I took her. She also ran to the car. I also ran to the car. We came to the car. She was that time she was 3 years old. Now she's 8 years old. I'm talking. She was fine. I was fine too. It's just not, I was just not holding her. I was just running without thinking about her. That is what made me like really sad. Okay, so yeah, so now you understand the base, like proper distinction between all this. In your exam, you will have so many questions like that. With given the scenario, you have to tell me if it is sympathetic activated or parasympathetic activated. Okay. Okay, so now this is something you have already told me. Now we are going to go over the differences between the sympathetic and the parasympathetic. So first of all, I want you to understand, not really. We are going to go over the differences between the somatic and the autonomic. So you guys already told me that your somatic is actually what? Innervating your skeletal muscle, and then your autonomic is innervating the cardiac muscle, smooth muscle, and the gland. So now let's talk about one important anatomy of your somatic nervous system. So let me tell you about that. When I say somatic nervous system, what is happening with the somatic nervous system is you have your cell body in the cell in your what central nervous system, and then from there your axon, which is your nerve, is coming out to innervate one nerve, which is coming out to directly innervate your what? Your skeletal muscle, right? But very highly myelinated. What does that mean? They are very, very fast, right? On the other hand, your autonomic nervous system is not one neuron, right? It is what? It is actually, it has like two neuron is making a chain. We call the autonomic nervous system is what? A two chain pathway. So that is why they have a preganglionic neuron and postganglionic neuron. So I'm not sure you guys are familiar with the term ganglion. So when we say ganglion, what do we mean by that? It's basically something like that. It's just a place where you have your what? You have your preganglionic neuron coming out. Preganglionic neuron is coming right here, and then you are making the synapse, and then this is your postganglionic neuron. So you have your ganglion, preganglionic neuron, and the postganglionic neuron. But whenever we are talking about the somatic nervous system, they have their cell body here, and from there the nerve is innervating your what? Skeletal muscle. Now here you have the preganglionic neuron, postganglionic neuron. This postganglionic neuron is innervating the different parts of the body. Okay. So now let's talk about something important, which is your preganglionic neuron is slightly myelinated, but postganglionic neuron is what? Non-myelinated. So what do you think is going to happen? Who's gonna be like more fast? Huh? I'm talking about autonomic versus somatic. So somatic is gonna be more what? Fast acting, right? So now let's talk about the neurotransmitter effect. So when we say neurotransmitter effect, this is very important because your neurotransmitters are basically the what? The language of your nervous system. By secreting the neurotransmitter, they are going to what? They are going to communicate with the different parts of the body, right? So your somatic nervous system is always what? Secreting the acetylcholine. Okay, always secreting the acetylcholine. But your autonomic nervous system, what is happening with your autonomic nervous system? All the time, in both cases, sympathetic and parasympathetic, your preganglionic neuron is always releasing the acetylcholine. However, your postganglionic neuron can either secrete acetylcholine or they can also secrete norepinephrine. And your somatic is always what? stimulatory, but your autonomic nervous system could be both. It could be because you want to increase your heart rate, also you want to decrease your heart rate, right? So what does it mean? Your autonomic nervous system is acting both ways. What does it mean? It is acting to stimulate or it's also inhibiting, right? Okay. So now let's talk about what are the similarities between them. Definitely both of them are actually what? Controlled by your integration center, which is your what? Central nervous system, right? Your central nervous system is controlling both of your somatic and the autonomic. And most spinal and many cranial nerve contain both somatic and autonomic fibers. So what does that mean? A lot of the cranial nerves and your spinal nerves are actually innervating both of your what? Muscle and the both of your skeletal muscle, glands, smooth muscle, cardiac muscle, everything. Okay. And then adaptations usually involves both skeletal muscle and the visceral organ. So active muscles require more oxygen and glucose, so autonomic nervous system speed up the heart rate and open airways. Okay, so adaptation. So what does it mean? Whenever you are trying to use your somatic nervous system, your autonomic nervous system is actually working together to help you, right? Does it make sense? Okay. So now this is the real comparison that we have been talking about so far. In the somatic nervous system, the cell body in the central nervous system, and heavily myelinated axon innervating the skeletal muscle, always releasing the acetylcholine, and only one neuron. But if you think about your autonomic nervous system, there are two neuron chain. Okay, and this is your ganglion right here. So you have your preganglionic neuron and the postganglionic neuron. Preganglionic neuron for both sympathetic and post-sympathetic is releasing the acetylcholine. However, sympathetic releases norepinephrine, postganglionic neuron, and postganglionic neuron of the parasympathetic neuron is what? Releasing the acetylcholine. So as you know that there are two arms of your what? Autonomic nervous system, your parasympathetic division and the sympathetic division. So when we say the parasympathetic division, what is it always trying to do? Conserve energy. Make sure that nothing is activated more, right? Except which one is activated more? Your digestion. Yeah. So sympathetic division mobilizes body during the activity. So it is not conserving an energy. It is trying to make sure your body have enough energy. Okay. So just to let you know, most of your body parts are actually innervated by both autonomic, both what? Parasympathetic and sympathetic. Do you know except what part? Which part? Does anybody have any idea which part is not supposed to be innervated by both? Huh? The brain. Do you want to always activate your brain?
Digestive tract.
Um. Huh? Huh? You're missing. So there is a thing. So for example, these days, whatever our lifestyle is, a lot of the time we are in sympathetic mode. But do you think you are not eating your breakfast, your lunch, your dinner? You are doing that, and your digestive system is working. Not necessarily it's working the best, like whenever you are calm or whenever you are resting. Does it make sense? Yeah. So that means they are innervated by both. Yeah. It's not that completely stop. Does it make sense? During sympathetic, your digestion is not completely stopped. Yeah, it's possible, but it's not as good as like whenever you are calm. Does it make sense? Okay, any other part that you can think of that which could be only innervated by one specific type? Huh? Blood vessels. Very good. Because your blood vessel, you do not want your blood vessel to relax. What do you think is going to happen if you have your blood vessel relaxed? They're gonna be, no, they're gonna be dilated so much, and then the no blood pressure. So if you do not have blood pressure, what is going to happen? You have to always maintain the specific blood pressure to be able to what? Provide the proper blood flow to the all the different parts of your body. This is something very important. Yeah.
So, but parasympathetic. So, like, can you say this again?
The question?
What's your response?
The response for the blood vessel.
Yeah.
So you you want to maintain the specific blood flow to your body. You want to maintain the specific blood pressure in your blood vessel. So that is why you want it to be slightly constricted all the time. You do not want you to be relaxed, so that blood vessel dilated so much and then what? Yeah, yeah. Always slightly constricted. Yeah. Okay, what else? What else? Do you think during the parasympathetic you want to anyway produce any sweat or anything? No, you do not want to do that. So your sweat glands are only innervated by what? Your sympathetic. What do you think about the arrector pili muscle? Huh? You only do that, you only need it when you have your sympathetic activated. So only innervated by sympathetic, nothing to do with the parasympathetic. Okay, so yeah, is it making sense or any question? So some of your body part is only innervated by sympathetic, but most of them are actually innervated by both sympathetic and parasympathetic. So now let's talk about the parasympathetic division. So when I say parasympathetic division, you guys already know what is going on during the parasympathetic. Most of your body is what? Relaxed, not trying to use a lot of energy. Only part which is very active is what? Your digestive system, right? And directs digestion, diuresis, defecation. So that is why after you wake up, you have to go to the bathroom, right? So refer to as rest and digest system. Example, person relaxing and reading after a meal, blood pressure, heart rate and respiratory rates are low, gastrointestinal tract activity is high. Very important, your pupils are actually constricted because you do not want to see far, and your lens are accommodated for the what? Close vision. You do not want to see far, you do not have to see far, right? So yeah, that's it. But what is happening in the sympathetic division? This is the opposite of your what? Parasympathetic. So mobilizes body during the activity, referred to as fight or flight system. Exercise, excitement, emergency, embarrassment activates the sympathetic system. Increased heart rate, dry mouth, cold, sweaty skin, dilated pupil. So when you are watching Netflix, is it, there is a thing though, there could be two things happening. Sometimes you are watching Netflix, you are not really focusing on the movie. You, in your mind, probably you are thinking about your crush, maybe you are excited, but if you are focusing on the movie, what's happening? So that is why always it is said that, like, okay, so whenever you are trying to watch movie or focusing on something, don't eat or something like that, right? Yeah. So exercise, excitement, emergency, embarrassment activates the sympathetic system, increased heart rate, dry mouth, cold, sweaty skin, dilated pupil. So during vigorous physical activity, shuns blood to the skeletal muscles and heart, dilates bronchioles, causes liver to release the glucose. So your question, does it answer your question? So you want to make sure that you have enough glucose in your system, because you have to use a lot. Like for example, during the fight or flight, what if you have to like run so much? So you need to use a lot of glucose. So your body prepare you what? With releasing a lot of glucose in the bloodstream. Okay. So then sympathetic is more complex and innervates more organs than parasympathetic. Some structures are innervated only by sympathetic, like your sweat gland, arrector pili muscle of the hair follicle, smooth muscle of all blood vessels. Does it make sense now, whatever I told you? Yeah. Okay. Let's see how much you remember. Since thick myelinated axons conduct the fastest, and since the synapse causes delay, which sends motor signal more rapidly, somatic or autonomic? Somatic, right? Because this is more myelinated. What neurotransmitter is released by the preganglionic neurons of the autonomic nervous system? Preganglionic neuron, always acetylcholine. So which ANS division is for fight or flight? Sympathetic. Very good. So now let's talk about what are the different organs in your body innervated by your sympathetic and parasympathetic. But before that, let's talk about some of the differences between the sympathetic and parasympathetic. So what do you see in your parasympathetic? All of these organs that are innervated, what do you see right here? Where is the cell body coming from? Most of the cell bodies are in the cranial nerve and only in the what? Sacral nerve. Okay. Other spinal nerves are not innervating the organs to what? To control your parasympathetic activity, right? So cell bodies for the parasympathetic, your cell bodies are in the cranial nerves, in the brain, or in the what? Sacral nerve, right? And what do you see about the, what is the differences do you see in between your preganglionic neuron and the postganglionic neuron? All the postganglionic neurons are what? Shorter than the preganglionic neuron, okay? And then these ganglia are actually close to the organ. The ganglia was close to the organ. So now look at the sympathetic. Most of the organs are innervated by the what? Spinal nerve. They are innervated by the what? Spinal nerve. And your preganglionic neuron are actually what? Shorter in this case, and your postganglionic neurons are actually what? Longer. And when you look at the ganglia, most of the ganglia are making a sympathetic trunk which is close to your what? Vertebral column, okay, which is very different from your what? Parasympathetic. However, for some of them, the ganglia could not be present in the sympathetic trunk. Sometimes they could be present what? Out of the what? Sympathetic trunk. But the main differences is the cell bodies are in the spinal nerve, and then what is happening? They have the sympathetic nerve for the sympathetic trunk for the what? Ganglia, and then you have your preganglionic neuron shorter and the postganglionic neurons what? Longer. Now look at the parasympathetic division of the autonomic nervous system. So in your exam I have asked you, so we know that you have your cranial nerve 3, which is your what? Olfactory, optic, oculomotor. So this is innervating what? Eye, lacrimal gland, right? So now your 7, which is your facial, is innervating the what? Your facial is innervating the what? Lacrimal gland, your nasal mucosa. And then your 10, which is your vagus, innervating most of the body part like your heart, lung, liver and gallbladder, stomach, pancreas, right? Your large intestine. So in your exam I asked you which nerve is innervating which organ, okay? So for example, vagus nerve did not innervate which of the following? Like maybe I can give you like heart, lung, liver, rectum. Which one is not innervated by the vagus nerve, right? So this type of question. So make sure you understand which one is innervating what. So now let's talk about the sympathetic anatomy. So for the sympathetic anatomy, you have your preganglionic neuron and the postganglionic neuron. First of all, what are they doing is preganglionic neuron fibers pass through the white rami communicantus. Who remember what is white rami communicantus? We did talk about it in chapter 13. Rami is the what? Branch of your branch of your what? Nerves. Okay. When two rami communicate with each other in a specific place, we call that rami communicantes. If that rami communicantes is myelinated, we call it white rami communicantes. If it is not myelinated, we call it gray rami communicantes. So resemble a pearl necklace string composed of the axon, pearls composed of the sympathetic trunk ganglia housing cell bodies. So the postganglionic axon exit the sympathetic trunk ganglia via the gray rami communicantes. And when we say the gray rami communicantes, these are non-myelinated. So postganglionic neurons are non-myelinated and preganglionic is what? Myelinated, which is slightly myelinated, not heavily myelinated like your what? Somatic nerves. So now let's talk about your sympathetic anatomy. So you have the 23 paravertebral ganglia in the sympathetic trunk. Do you remember what is the sympathetic trunk, which is close to your vertebral column? So it has the 23 paravertebral ganglia, 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, and 1 coccygeal. So who remembers about this thing? Everyone knows, right? What is happening? You have your lateral horn. From the lateral horn, you are getting the innervation to your what? To your autonomic. That's the autonomic, right? So you are getting innervated to which part? What type of the muscle? Huh? Skeletal muscle? Smooth muscle. You are getting the innervation to smooth muscle. So this is always from the what? Lateral horn, right? But where do you see the synapse happening? In the synaptic trunk. So you have your origin right here, the synapse is right here. They're almost at the same level. Okay, they can be at the same level. Synapse can happen at the same level. Synapse can happen, so this is the origin. Synapse can also happen at the higher or the lower level. Okay, sometimes synapse can happen out of the sympathetic trunk, out of the sympathetic trunk. So this place right here that we call where you have the synapse is the collateral ganglion, not in the ganglia, in the ganglion in the sympathetic trunk. It is happening in the what? Collateral ganglion. When the synapse is happening in the collateral ganglion, that is when you call them splanchnic nerve. What do you call it? Splanchnic nerve. First of all, we know that the greater, lesser, least splanchnic nerve, these are based on the synapse that are happening in the sympathetic trunk, but lower, higher, or the same level. But if it is happening in the lumbar, you call it lumbar splanchnic nerve. In the sacral, you call it sacral splanchnic nerve. The splanchnic nerve interweave and forming abdominal aortic plexus. Everyone knows what is plexus, right? When we say plexus, there is what? A lot of nerve junction. Okay. So now this splanchnic nerve interweave forming aortic plexuses that contain several important ganglia. So celiac and superior and inferior mesenteric ganglia, and postganglionic fibers from these ganglia, pathways to abdomen, pathways to pelvis. So I know this is not very clear to you. We are going to look at all of them in a picture, then it's going to be more clear. But one thing I want you to understand, there is an exception. We know that we have our preganglionic neuron, you have your postganglionic neuron, they are synapsing in the what? Sympathetic trunk ganglion or collateral ganglion. However, there is only one exception, which is this one right here, which does not make any synapse. You have this preganglionic neuron, which is arisen from the what? Lateral horn and directly going to the organ, which is your adrenal medulla. From the adrenal medulla, they are going to directly secrete the norepinephrine and epinephrine into the blood. So this is the one exception. Okay, everything else is actually making the synapse. So what do we mean by that? You have some of them which are making synapse in the sympathetic trunk. Some of them are making synapse in the where? Collateral what? Ganglion. Collateral ganglion. So the collateral ganglion right here, only one of them right here is directly going to the adrenal medulla to release the what? Epinephrine and the norepinephrine. Now let's talk about the visceral sensory neuron. So when we say visceral sensory neuron, what do we mean by that? Viscera means what? All of your organs inside your body, right? So whatever information you are getting from your viscera, like for example, if you have a stomach pain, right? So how do you understand that? You understand that you receive that information because you have a nerve which is collecting the information from your stomach to your central nervous system so that you can actually feel that there is something wrong happening in your stomach. Does it make sense? However, there is a thing that I want you to understand. Sometimes, like for example, if you think about, you have your lungs here, right? And then from the lungs and also from other parts, like for example, your lungs, your trachea, you are getting innervation, and all of the nerves are actually converging and then going through this way to your central nervous system. So what's going to happen? You're probably not going to feel the pain in the what? In your chest. Instead, probably you're going to feel the pain in the neck. So this is called referred pain. This is called what? Referred pain. The reason you have the referred pain, sometimes when you go see doctor, your doctor is going to ask you like, where do you feel the pain? To be able to understand where is this actually pain coming from, right? Okay, yeah. Yeah, yeah, a lot of the nerves coming from the different, like it's almost like this. So for example, one nerve is coming from your lungs, one is coming from your trachea, another one is, this is your preganglionic neuron, right? And then from here you have, they are converging and to go to the what? Your central nervous system. Does it make sense? So now both of them are bringing the information to your central nervous system through one pathway. So that is why you have the what? Referred pain.
And that's where you get brain freezes too, like when you eat something really cold, you don't feel the pain on the roof of your mouth. You feel it
Yeah, yeah, that's true. Yeah. Any more question before we move forward? Okay, so you understand what is going on right here. So you have the receptors widely scattered throughout the viscera. You have the receptor over there. You are taking the information and bringing the information from there. But the cell bodies are located in the dorsal root ganglia and in sensory ganglia of the cranial nerve. So axon travel in same nerves as autonomic motor fiber, and visceral sensory neuron can converge on same second order sensory neuron. So second order sensory neuron that receive input from somatic sensory neuron, so play a role in referred pain. Now let's talk about the visceral reflexes. This is the picture you have been looking or seeing for many times. So every time we talk about the reflex, what do we mean by that? You have a receptor, you have sensory neuron, you have interneuron, you have motor neuron, you have the effector. So when we say visceral reflex, you exactly have the same thing, but only thing you need to understand, the receptors are in the viscera, and these are the visceral sensory neuron. And what is the effector? The effector is going to be the visceral effector. So your visceral effector, your viscera, the effectors are the viscera, the organs, right? Okay, so what did you learn so far? Where are the cell bodies of the sympathetic preganglionic neuron? Sympathetic preganglionic neuron, which part? Spinal cord, right? Sympathetic, all of them are coming from spinal cord, right? Yeah, yes or no? Everyone forgot. Did you all forget this picture? All of them, all the sympathetic cell bodies are coming from your what? Your spinal cord. But if it is parasympathetic, they are coming from where? Parasympathetic is coming from Your brain and the sacral, right? Okay, so the next, do the white rami contain preganglionic or postganglionic axon? Preganglionic all the time. Always preganglionic is the one which is slightly myelinated, and postganglionic is what? Always non-myelinated. So where are the target organs for the splanchnic nerve pathway? The splanchnic nerve pathway. Do you remember the splanchnic nerve pathway? These are all splanchnic nerve pathway. So your splanchnic nerve pathway, you can have the what? Your liver, gallbladder, stomach, spleen, kidney, right? Small intestine, large intestine, all of those. Okay, so now let's talk about the neurotransmitter. You guys already know that your autonomic nervous system produces two different type of the neurotransmitter. One is the what? Acetylcholine. Acetylcholine is released by all the preganglionic neuron, and postganglionic neuron for the who? Postganglionic neuron for sympathetic or parasympathetic releases as acetylcholine. Sympathetic or parasympathetic releases acetylcholine? Huh? Preganglionic, both of them releases acetylcholine. But postganglionic, everyone forgot this picture right here. Let's look at this one more time so that you remember what I'm talking about. Your preganglionic neuron for both sympathetic and parasympathetic releases acetylcholine, but postganglionic for sympathetic releases norepinephrine, and postganglionic for parasympathetic releases acetylcholine. Never ever forget that. Okay, this is very important. Now the question becomes, is it going to be active stimulatory or inhibitory? The stimulatory or inhibitory is actually depend on the receptor they are getting bound to. Okay, if they are bound to what they have, your body has different type of the receptor, right? Cholinergic fiber, like for example, for the cholinergic fiber you have nicotinic receptor and the muscarinic receptor. For adrenergic fiber you have the different type of the receptor like alpha, beta, and all this. Okay, so which receptors your neurotransmitters are bound to is going to determine what is going to be the impact. Okay, so the effects of the neurotransmitter depends on the whether it binds to the cholinergic receptor or adrenergic receptor. So what are the cholinergic receptors? So let's talk about the cholinergic receptor. As I told you, you have two different type of the cholinergic receptor based on what type of the what binds with the receptor. So you can have the nicotinic receptor, you can have the muscarinic receptor. If it binds with the nicotinic receptors, always stimulatory. That is why a lot of people smoke, so that they can activate your body quickly, right? Yeah. So nicotinic receptor, whenever you are binding with the what? Nicotinic receptor, that is what? Stimulatory. And muscarinic receptor, we're going to talk about that. So named after the drug that bind to them and mimic the acetylcholine. So nicotine and muscarine is the what? Is a mushroom poison. So now the nicotinic receptor is found on most all of the postganglionic neurons, sympathetic and parasympathetic, hormone producing cells of the adrenal medulla and skeletal muscle cells of the neuromuscular junction. Effect of the acetylcholine at the nicotinic receptor is always stimulatory. That is why people smoke, right? Because they just wake up their body and they get actually what? Habituated to that. Okay, so now muscarinic receptor found on all effector cells stimulated by the postganglionic cholinergic fiber. So effect of acetylcholine at the muscarinic receptor can be both inhibitory and the stimulatory. Okay, so for example, depends on receptor type of the target organ. So binding of acetylcholine to the cardiac muscle cell slows heart rate. So for example, if you have high blood pressure, so your doctors can give you something, what maybe give you acetylcholine so that it binds with the what, cardiac muscle to slow the heart rate. But binding to the intestinal smooth muscle cell increases the motility. Okay, so different organ has the different type of the impact. Sometimes they can have the inhibitory impact, sometimes they have the what, stimulatory impact. If it is on the heart, muscarinic receptor acts as what, inhibitory. So as you can see, nicotinic receptor is always what, stimulatory, and your muscarinic receptor could be both stimulatory or inhibitory based on the what, based on the organ they are located on. So now you know your acetylcholine in the somatic nervous system always what, stimulatory, but this one could be both stimulatory or inhibitory based on the type of the receptor. So now let's talk about the adrenergic fiber. Adrenergic fibers could be two different types, so alpha and beta, and alpha have two different types, alpha 1, alpha 2. Beta has three different types, beta 1, 2, 3. Okay, so now what is going to be the impact? So different one have the different type of the impact. Like for example, if norepinephrine binding through the cardiac muscle, beta 1 receptor, it's going to increase the heart rate. Okay, it's gonna increase the heart rate. Whereas epinephrine, that is why you are given the beta blocker. When you are given the beta blocker, when you want to decrease the heart rate, right? Whereas epinephrine causes bronchial relaxation and bound to beta 2 receptor. So what do we mean by that? So your alpha and alpha 2, what, always stimulatory, but beta 1 is stimulatory for heart, kidney and adipose, beta 2 inhibitory for lungs, blood vessels, muscles and the organ, and beta 3 could be what, stimulatory or inhibitory for the adipose. And as you can see in this chart, whatever we have been talking about so far, like for example, if norepinephrine and epinephrine released by the adrenal medulla and bind with the beta 1, increases the heart rate and force of the contraction, stimulate the kidney to release the renin. But if it is beta 2 receptor, what is going to happen? You're going to find that on the lungs and the most other sympathetic target organ. What is going to be the impact? Effects mostly inhibitory. So what do you mean? What you see what I'm trying to tell you? Yeah. They do not have to know the differences, but they have to know. I did ask questions like if which one is inhibitory, which one is like stimulatory. If it binds with the heart, what is going to happen? Why do you have to take beta blocker? What does that mean? Things like that. Okay. So what neurotransmitter is released by the preganglionic neurons of both autonomic nervous system division? Acetylcholine. Very good. Activation of which type of cholinergic receptor causes the heart rate to slow down? Muscarinic receptor, right? And activation of which type of adrenergic receptor causes the heart to speed up? Beta 1, right? Your nicotinic and muscarinic are cholinergic. Adrenergic are your alpha 1, alpha 2, beta 1, 2, 3. Okay. Now let's talk about the dual innervation. So as I told you, what is supposed to happen? Most of your organs in your body are innervated by both sympathetic and parasympathetic, and the ideal situation is you have to have both slightly active all the time, okay, to maintain the what, homeostasis. And sometimes they are actually cooperative. When they are cooperative, so action potentially continually fire down axons of the both division, producing a dynamic antagonistic interaction. Works to precisely control the visceral activities. Sympathetic division increases heart rate and respiratory rate and inhibits digestion and elimination. And what is happening? Parasympathetic, it's the opposite. What is decreasing? Your heart rate, respiratory rate, these are decreasing. But what is increasing? Your digestion and discarding of waste. So now this is something important. As I told you, both NS divisions are partially active all the time to maintain the homeostasis, resulting in a basal sympathetic and parasympathetic tone. However, for your blood vessel, which one is supposed to be active all the time? Sympathetic only, because we know if there is parasympathetic, what is going to be the problem. So now we always want the what? sympathetic. So now, for example, whenever your blood pressure increases, what do you want to do? You want to make sure that what? It's slightly decreases. Your sympathetic is up, but sympathetic activity slightly decreases. But when you want to increase the blood pressure, what do you want to do? Your sympathetic slightly, you want to increase it a little bit, right? So if blood pressure drops, sympathetic fibers fire faster than the normal to increase the constriction of the blood vessel and cause blood pressure to rise. If blood pressure rises, sympathetic fibers fire less than normal, causing less constriction of the vessels, which leads to a decrease in blood pressure. Allow sympathetic system to shunt blood where needed. Now let's talk about the parasympathetic tone. Parasympathetic division normally dominates heart and the smooth muscle of the digestive and the urinary tract organ, and it activates most glands except for the adrenal and the sweat gland. We already know that, and slows the heart and dictates normal activity levels of the digestive and the urinary tract, and always slightly activated. So that was the question, right? Some of you asking, some of you were telling me that your digestion is only controlled by your parasympathetic, right? It is not only controlled by your parasympathetic, it is controlled by both, but parasympathetic is the what? Main driver here. So almost all blood vessels are actually what? Innervated only by the what? Sympathetic. Rector pili muscle only by the sympathetic, your sweat gland only by the sympathetic, and kidney by the sympathetic. This is what is important, which is the cooperative effect. So this is what I talked about. Your what? Sexual intercourse is actually what? Cooperative effect. If you are not what? Relaxed, what is not going to happen? The erection is not going to happen, because parasympathetic fibers causes the vasodilation and are responsible for erection and penis, or erection of the penis and the what? Clitoris. But if you do not have your sympathetic activated, what is going to happen? The ejaculation is not going to happen, because sympathetic fibers causes the ejaculation of the semen in males and reflex contraction of the female's vagina. Okay, so now let's talk about the unique role of the sympathetic division. So your adrenal medulla, sweat gland, arrector pili muscle, kidney, and almost all blood vessels receive only sympathetic innervation. So other unique functions of the sympathetic division include thermoregulating response to heat. When body temperature rises, sympathetic nerve dilate the skin blood vessels, allowing heat to escape, activate sweat gland. When body temperature drop, blood vessels constrict. And release of the renin from the kidney, that increases the blood pressure. That is also by your sympathetic division. So sympathetic system causes release of the renin from the kidney, that in turn activate a system that increases the blood pressure. And metabolic effects, always sympathetic division increase your metabolism, right? Raises blood glucose level, mobilizes fat for use as fuel. So don't mix it up. Digestion and metabolism is not same, right? So which one increases during the sympathetic? Metabolism, but digestion increases during the parasympathetic. Both of them are not same. Remember, when we say digestion, what do we mean by that? You are breaking down the food in your digestive system. And when we say metabolism, that is you are producing energy from that glucose that you are taking into yourself, right? So that is the metabolism. So that increases during the sympathetic, but the digestion increases during the parasympathetic. So now let's talk about the localized versus diffuse effect. So parasympathetic division tends to elicit short-lived. This is what I told you, right? Your parasympathetic is short-lived. You wake up from the sleep, you are ready to go, right? Right after you wake up, you are good. But what about your sympathetic? Once it's activated for any reason, it's going to be active for a long time. What is the reason? Because you know that for the sympathetic, the parasympathetic, the driver is the acetylcholine, and we have acetylcholine esterase to break it down when we do not need it. But when you have your sympathetic, you have the norepinephrine, but there is nothing to actually what? Break the norepinephrine down. Whenever you have a lot of norepinephrine in your system, you cannot break it down right after that. You your body requires a lot of time to make sure it's decreasing from your system. Okay, so now for specific body parts, what is the impact of the parasympathetic, what is the impact of the sympathetic? What happens to the eye during the parasympathetic? Your pupil, parasympathetic pupil constricted, right? Sympathetic pupil dilated. Lens, what happens to the lens? During the sympathetic you want to look at far, so it's accommodated for the what, far vision. And during the parasympathetic you want to relax, you do not want to think about what is far, so it is accommodated for the what, close vision, right? We talked about the eye, ciliary muscle. Now what about the glands? What happens with the, so the glands, a lot of the time your glands activity increases during the what, parasympathetic. A lot of the time a lot of the glands are actually associated with the digestion, right? So it increases during the parasympathetic, and sympathetic it what, decreases. But what about the sweat gland? Sweat gland is only activated by the sympathetic. Parasympathetic has no impact. Adrenal medulla only by the what, sympathetic. Arrector pili muscle only by the sympathetic. And what about your heart? It could, parasympathetic decreases, sympathetic increases. What about your blood vessel? No effect, because parasympathetic has nothing to do with your blood vessel, always sympathetic. Okay, like that it's gonna keep going. So make sure you know what is happening to each of the organ due to the impact of the what, due to the impact of the different type of the division, like sympathetic and parasympathetic. So now let's talk about what happens when you have neuropathy, that means damage in the nerve, right? If you have damage in the nerve, what is going to happen? Autonomic neuropathy. So damage to the autonomic nerve, that is common complication of the diabetes mellitus. So we know that during the diabetes mellitus what happens? We have a high blood glucose level. So for your neuron cannot survive without the glucose. So your creator made sure that they do not have any door for the what, glucose to enter into the cell. So they always have their door open for the glucose. The more glucose they will have, the more happy they are. But you know what? More of the good thing is also bad for you, because if you are taking more glucose, what is going to happen? Your neuron is going to get damaged. Okay, so that is why due to the diabetes mellitus eventually you are going to damage your neuron. Okay, so early sign includes sexual dysfunction. Okay, so those are the small nerves that you are going to damage the first. Other frequent symptoms include dizziness after standing suddenly, urinary incontinence, sluggish eye pupil reaction, impaired sweating. Best way to prevent diabetic neuropathy is to maintain the good blood glucose level. So now who is controlling your what? Your autonomic nervous system? Definitely your brain, right? It's your brain. So we have different parts of the brain that we know that the hypothalamus is the boss. Why hypothalamus is the boss? Because this is the one which is actually what, communicating with your body and the brain to make sure, relaying between the body and the brain to make sure that your homeostasis is maintained, right? So now how they're communicating with each other? They're communicating with your brain stem and the spinal cord, and also with the what, limbic system, which is your emotional input, and your frontal lobe, which is your cerebral cortex, right? They are also impacting your autonomic nervous system. So what about the hypertension? Everyone knows what is the what? Hypertension. What is hypertension? High blood pressure, right? Overactive sympathetic vasoconstrictor response to stress. So whenever you have very high blood pressure, one of the good way is what? Calm down, right? You do not want your sympathetic to be activated so much. If you have your sympathetic activated so much, it's going to constrict your blood vessel so much, and then you will have your blood pressure increases. So heart must work harder, and artery walls are subject to increased wear and tear, can be treated with the adrenergic receptor blocking what? Blocking drug. So now sometimes you can also have some part of your body is not receiving the blood flow properly. Okay, sudden constriction of the small arteries of the digit result in loss of the normal hue of the distal skin. We know that usually if you look at your hands and the digits, you will say all of them have a red hue because they are receiving the blood flow. But due to the what? Loss of the normal hue of the distal skin accompanied by the pain triggered by cold or the emotional stress due to exaggerated local sympathetic response, more common in women. What do you think? What happens when we age? Do you think your autonomic nervous system activity increases or decreases? Decreases as we age. That is why as we age, we do not have a proper bowel movement. Your digestive system is not working properly, right? So you start to have the constipation, and then you have the dry eyes, frequent eye infection, orthostatic hypotension, low blood pressure after position change, pressure receptors are less responsive to the blood pressure change, cardiovascular center fail to maintain the healthy blood pressure. So what did you learn so far? How do the sympathetic and parasympathetic division influence GI tract motility? So when you have your sympathetic activated, you have less motility, and when you have your parasympathetic, it's more. What happens to your blood vessel diameter? You only have the sympathetic activated, and this sympathetic can increase when you want to increase the blood pressure. It gets decreased when you want to decrease the blood pressure, and that is how your body controls the blood pressure, only by the sympathetic division. And that's all about this chapter. Does anybody have any question? No question.